Hello and welcome to the channel where we discuss medical topics and lifestyle. In today's video, we are talking about adolescent self-harm. So it's a bit more of a serious topic, but a serious one nonetheless. We're going to cover some really damning statistics. We're going to cover how self-harm in an adolescent presents, discuss a structured approach, how to assess it, and also help promote the effective and safe management of it. So whether you're a doctor or not, or just concerned parent or friend or family member, we have something for you in this video. So let's get into it. All right, so let's do a bit of an intro. So, what is self harm actually? Let's define it. So, it is not a diagnosis. That's the most important thing to recognize here. So, again, it is not a diagnosis. So, what exactly is it? Well, it is a way that a young person can try to manage previous trauma, the way a young person can express difficult feelings, and the way that a young person can respond to an overwhelming situation. So that's actually what self harm is. It is not a diagnosis. It is complex, it is very multifactorial, and the big problem nowadays is that it is becoming increasingly prevalent and it is a major risk factor for suicide and mortality overall in young people. So that's the absolute worst thing about it. It is actually so common and so prevalent that, at least over here in the UK last year, the mental health team called it a crisis. It said the system was at a breaking point and the overspill was actually coming into the primary care, the family physician. So they're dealing with it more and more often. What exactly is self harm? So it's any activity that deliberately harms oneself. So it's cutting, burning, punching, overdose, among other examples. So that's what self harm is, and now we've defined it. The most important thing is that it's not a diagnosis. So now let's get into a little bit of a background. So let's talk about the actual World Health Organization and some of the institutes that we have locally here, at least in the UK and probably abroad as well. So the WHO says that mental conditions accounted for 16% of the global burden of disease in 10 to 19-year-olds. That's crazy. Suicide is the second leading cause of death in people aged 15 to 19. Incredibly crazy. So these are some really evident facts there. And over here in the UK, the Royal College of Psychiatrists says that around 1 in 10 young people in the UK will self harm at some point. Again, 10% crazy. So why is it happening? Why is it happening? Well, there's some common themes. So the incidence is greater in girls. It's more common in areas of high social deprivation. And then we have some risk factors that are really jumping out at us and can point us in certain directions. So we have social, genetic, biological, and psychological risk factors that we need to keep in mind. Social factors include adverse childhood events, such as so-called ACEs. They can include parental separation or death, abuse, bullying, drug, alcohol misuse. Then from a biological risk factor, we have family history of suicidal behavior or female gender. Psychological risk factors include depression, anxiety, autism, and attention, ADHD as well. So these are all things that are going on there. And then another big one is that having a lesbian, gay, bisexual orientation or identifying as a transgender person also increases the risk of self-harm. So these are facts. This isn't having an opinion against anyone or anything like that, but it's just the risk factors that we have to keep in mind essentially. And then we have internet. So this is a really big one and it's gray for a reason. So some studies have shown a correlation between high internet use and self-harm. This can maybe be because the internet can normalize self-harm in certain cliques and groups, but also there's a benefit of it perhaps as well, where social media can benefit the young person by reducing isolation, a stronger connection, stronger community, and things like that. So it's up for debate a little bit, and there are studies going one way and the other. So internet is something to keep in mind, absolutely. This is something that we should all be doing, whether it's a parent or a carer or a doctor as well. So it's not just strictly for the doctor to assess this kind of a thing. So there are a few factors to consider here when assessing somebody. So there's a few overarching themes. Again, doesn't matter where you're from, who you are, if you're family or whatever, but you should take it seriously, respond empathetically, show compassion. So see, these are just some pretty standard things that you really should be doing. And then overall, you need to take a holistic psychosocial assessment. So what I mean by that is assessing the home situation, the social situation, and the school situation. So these are generally the three scenarios that we have to cover when doing this holistic approach. So when it comes to the home situation, it's important to identify safeguarding, Safeguarding issues should be explored, for example, domestic abuse, violence, exploitation. Also, when it comes to social and school, there's social media, like we mentioned earlier on, the friendship groups, romantic as well. So, are all these things prompting in certain directions? Then, the main thing to identify, the absolute main thing to identify is the trigger. So, what pushes the person's buttons? So, that's the most important thing. What leads them to consider the action, to do the action? Do they have the feelings of worthlessness or hopelessness, emotional dysregulation? Is it a feeling like that makes you in control? So these are the things to identify. Research has also shown that asking about suicidal intent does not increase the risk of future self harm or suicide. So that's something very important to actually keep in mind here. But this is overall how you assess it. So, of course, some things will fall under the domain of the assessor in terms of a clinician a little bit more, but other things you can definitely assess for just by being a friend, person of concern, parent. And now let's do some management. So again, whether you're a clinician or not, or just a parent, let's manage this properly. Let's really take this into consideration. So the young person who self-harms needs a referral for help. Absolutely. So mental health services need to be involved in whatever way possible. So whether that includes therapy and things like that, a referral needs to be done. Then the second thing that we need to do is we need to assess the risk. So is the frequency or degree of self-harm or intent increasing? Is the person providing the assessment concerned, right? So is the doctor really concerned? Is the person asking for more help? Is the person crying out for help? And are the levels of distress in family or cares rising? So these are kind of risk flags that are making us jump out. And then another practical thing that you can do with the actual individual, with the young person, is to make a safety plan. So that's very, very important going forward. Just like there are other plans in other aspects of medicine, an asthma plan, for example, this is a safety plan for self harm. So, are there early warning signs? Meaning, how can others know I'm feeling distressed? Do I start shouting, picking my nails, shaking, scratching, pulling my hair? What are things that can cause me to feel upset or distressed? Being asked about bad experiences in school, bullies, English class, seeing mom and dad fight, for example. What are my coping strategies? So, things that I can do to help myself. So, counting, taking deep breaths, things like that. What can others do for me when I'm feeling distressed? Give me quiet space, leave me alone for a few minutes. What are things that can help, that have worked in the past and what that haven't worked in the past? So playing my switch, or sitting quietly with mom watching cartoons, these are things that help. And what didn't help is mom asking a lot of questions, for example. And then at the end of the day, the most important aspect of the safety plan is the support system. So who can somebody reach out for if something is going on? So, can I call mom? Can I call dad? Can I call for help of any sort? So, this is a safety plan. It's very important for kids to feel that, and young people to actually have that in place. And then finally, we have some safety recommendations for parents and carers. So, absolutely, some cold, hard kind of facts and helpful tips that really need to be taken into consideration. So, parents' carers should remove all medication, sharp objects in the household, put them in a safe. Be mindful of harmful products that can be swallowed or used. So, cables, cords, bleach, washing things. Increase the supervision, right? Monitor your child where possible. Have some rules in place, an open door policy, regular checkup, making it easier to keep a closer eye on your child. You need to know where the child is at all times, who they're with, where they are, and ultimately communication needs to be established. So who can you call? What are the numbers? Everything needs to be put in place. And really, if you don't know where the child is, where the young person is, report it. Report it as a missing person. That's very scary. It sounds like it, but the fear of actually, the risk of self-harming is actually greater than you being scared reporting it. So as a parent, these are your responsibilities. These are your safety recommendations. I really, really hope that everybody learns something from this video, whether you're a young person going through this trouble or whether you're a concerned parent or friend trying to help somebody out. I hope this was a very useful video, and like and subscribe for more. We'll see you in the next one. Please leave a comment in the section below what you think and what you think we should cover next. Take care.